Could it be Perthes' disease of the hip?
It's a chest X-ray.
I thought it might be a trick question. Well, I put my money on the heart.
How much?
The lungs, then. Well, those fluffy bits. Now, I've seen those before.
They're blood vessels, you Burke.
Well, I give up. It looks completely normal to me.
It is completely normal.
Then why has Loftus donated it to the Radiology Museum?
Because it is of him.
Him?
Him.
Do you mean to say he's had these done specially for the museum?
Yes, and all those as well.
Good grief, is there no limit to the man's vanity? He's so thick-skinned, it's a wonder they could get a picture. We better look at these while we have the chance. In all my years at St. Swithin's, I've never seen inside a surgeon. Ah, the surgeon's hands.
Oh, no. Those are the surgeon's feet. You can tell by the toes blunted from years of kicking housemen around.
And that face looks even more frightening like this.
Oh, do you think so? I think he looks just like anyone else, actually. That's why he has to wear that stupid moustache across there.
Clothes as I am wearing. To discourage any sign of medical interest on your part, those X-rays are not for general display, they're for the museum.
Oh, but they're so very interesting, sir.
Well, of course they're interesting. But I have plenty of scope for your medical curiosity at the Divisional Clinical Conference.
Oh, you're presenting a case, sir? I'll check my diary.
You do better to look at your watch. You're presenting the case, and it's at 3 o'clock this afternoon.
What?
It's been sprung on me by High Cross. I had to agree to hold it here because their conference room is out of action. Had the psychiatrist in last week, and they won't come out. You know Sir Edmund Steele?
Oh, yes, we've met. And, of course, I've read all his papers, sir.
Oh, have you? Well, he'll be here this afternoon with his satellites. He'll be presenting the other case.
What, another case? Any idea what it is, sir?
Knowing Sir Edmund, it'll be long, brilliant, and extremely dull. All you've got to do is come up with a good, snappy case of exceptional medical interest.
Yeah, I don't think we've got anything like that at the moment, sir.
I am relying on you, Waring, to put up a good show for St. Swithin's. I have briefed Gascoigne, but I'd only use him as a last resort.
Is Gascoigne of exceptional medical interest, sir?
Shut up, Clark. 3 o'clock, then, Waring.
But that's only 2 hours, sir.
You are my surgical registrar. If you can't stand the heat, get out of the kitchen.
Yes, sir.
And I don't want those X-rays left lying around. I want them in the museum.
You got my surgical registrar. Get out of the kitchen.
I haven't got any interesting patients.
Oh, I'm sure you'll find something somewhere around the hospital. I might just give you a hand and do a quick recce myself if I have a spare moment.
Thanks a lot. You wouldn't know an interesting case if it was stuck halfway up your nose.
I'll have you know I made a very interesting discovery only this morning. Have you met Maureen, the new radiographer?
No, what's wrong with her?
Nothing. She's absolutely fantastic.
A great deal out you are. Look, I tell you, all my patients are perfectly normal, you know. I mean, why shouldn't they be? It's not going to be much more fun to them whether they've got pseudo-hypoparathyroidism or piles.
Well, they're only human. I mean, we all need something out of the ordinary to give us a lift now and again. Why do you think I read the papers?
Knitting page and the racing results?
Because there's always something peculiar going on. Now, listen to this. UFO lands on Marrows. They came from outer space, says Mrs. Button, 48, a local housewife. Last night, as usual, she went into the back garden to put out bread and cheese for the hedgehogs. There she saw the luminous intruders leaving their ship.
Oh, it's science fiction. Oh, blast.
Yes. 50 years ago, you'd have called that science fiction.
Have you really been here that long?
So this spaceship, this long, gleaming metal thing at the bottom of your garden, did it remind you of anything from the past, Mrs. Button?
Well, it's funny you should say that, because when I first looked up, I thought it was the Anderson shelter. And I thought, no, don't be daft. They come and took that away after the war. I must be seeing things. But when the little green men started to come out, I knew there was something there.
These little green men, were there any little green women with them?
Women? On a spaceship? Don't be daft. You'll be asking for trouble. No, anyway, I walked towards them waving this white tea towel. Well, it was almost white. When suddenly, the next thing I knew, I slipped on the path, twist my ankle, and down I go. Well, I thought it was just excitement. But then I saw it was all this green slime. Yeah. They'd left it everywhere they'd been. Anyway, that's why I like this ankle x-ray, please, Doctor. I mean, it could be a sprain, but you never know, do you?
Yes, I will see about that in a moment, Mrs. Button. But there was something you said earlier that I thought was very, very interesting.
Yeah, well, you see, my friend Joy, she walked about with a broken ankle for 2 weeks, had to take her leg off.
Guess what?
Oh, another doctor.
It's you, Duncan.
Yeah, doctor.
Excuse me a moment, Mrs. Button. I must just have a quick word with my colleague.
Oh, all right.
No. Was that the one you wanted me to have a look at?
No, not that one. It's the patient in the opposite cubicle. Chap with tummy ache, it sounded surgical. Well, I simply haven't had time to look into it.
Tummy ache? Look, since when does a casualty officer believe he's a surgical registrar to examine his patients?
Well, terribly sorry, Duncan, but we are friends, and I've got my hands rather full at the moment. Actually, I've got a red-hot case for the conference. Unless you come up with anything, of course.
Oh, no, don't worry. No, I'll just keep the casualty running. You know, you carry on with the interesting stuff.
Oh, thank you, Duncan. I really appreciate this. You know, we must have a good long talk one of these days.
Pillock.
Duncan, you left these behind, the Furor's x-rays.
Shove them on there, Dickley.
I'll get Maureen to send them over to the museum. Oh, you haven't seen Maureen around anyway?
What, seen Maureen?
Yeah? What?
Well, good morning, Mr. Andrews. What seems to be the trouble, eh?
Well, it's my tummy ache, Doctor.
I see. When did it come on?
Well, I felt great this morning when we got on train at Preston. We were playing poker, and I'd just taken over as banker when it all started.
I see. Whereabouts?
Near Macclesfield. You know, it might have been something I ate on train. I'm going on this cruise, you see, and I just want to make sure it's not me appendix.
I see. All right. Well, if you'd lie back and bare your tummy, we'll check everything.
That's it. There we are.
That's good. Right. Now, feel any pain there?
No.
No? There?
No.
Oh, well, that's good. It's not your appendix anyway. Now,
Oh!
eh?
It's cold.
Oh, sorry. Well, apart from your appendix, how do you feel?
Oh, I feel fine. Never felt better.
That's all. I can't hear anything. Oh, it's not a technical hitch.
Hey, listen, am I all right?
Right! I don't believe it. It's fantastic. It's too good to be true.
What is?
Hey, look, has anybody ever told you your heart's on the right-hand side of your body?
Get off. No one's ever told me that before. Is it true?
Yes, we'll take some x-rays. You can see for yourself. It's fantastic.
Is it?
Yes. There's no need to worry. You're perfectly healthy. No, you just lie back there. Don't talk to anybody. And I'll go and see the x-rays, eh?
Well, everything else seems right road round. Me right hand's here, me left hand's here. I just don't understand it.
Oh, Sir Geoffrey. Sir Geoffrey, I've got a case here that would be ideal for the conference.
It seems as wearing. You phoned me and told me all about it. Where is it?
Oh? Oh, no, there must be some mistake, Sir Waring, seeing a chap with tummy ache. It's a routine case, but mine has enormous potential. It could take the conference by storm. Of course, I'd like your opinion first.
All in good time, Gascoigne. Where's my registrar?
Oh, he's just in there, sir.
Unbelievable. Dick, make your find, but you can't find it.
No, I can't.
Well, clerk, what do you hear?
Nothing, sir. Not a peep. Can't hear anything.
Would you care to confirm that observation, Gascoigne?
It's true, sir. It's pericardial effusion, isn't it, sir?
Clever suggestion, Gascoigne. Do we have any X-ray evidence for that?
Oh, yes, do we have the x-rays, Duncan?
Oh, yes, do we have the x-rays, Duncan?
Oh, on the table, Dunky Wunky.
Excellent. Follow me.
Well, Gascoigne, any sign of an effusion? If there is, I fail to see it. You were right, Waring. Well done. This will do nicely for the conference. Now, can anyone tell me why?
I don't honestly think I can, sir.
I know this is a stupid question, Clark, but have you got any theories?
Well, sir, I suggest he's a member of a highly evolved species, probably from another galaxy, whose bodies are constructed on entirely different principles and the organs work in complete silence.
Most ingenious. I'd be intrigued to hear how you arrived at your diagnosis. Ah. Well, we know, don't we, Dr. Waring?
Yes, sir.
Would you like to tell them?
Oh, it's certainly quite simply, Mr. Andrews is a very remarkable man.
He's one of them! Them! Turn off the lights, you'll see him glow! He comes that green slime! He comes from outer space!
Good grief. I was right.
Outer space? The silly old bat I come from Preston.
No, Gascoigne, certainly not. Outer space, little green men, the conference would be a shambles.
But, sir, I believe this woman is a fascinating psychiatric case. The syndrome is classical.
There's no question of having this crackpot anywhere near the conference. Give her the ankle x-ray and send her home with a social worker.
Oh, well, you know best, sir.
Correct. Now, Mr. Andrews, with your permission, I should like to listen here. The heart is on the right, just as I suspected. Dextrocardia. Doctors usually miss it. Radiologists always do. Complete situs inversus. All those organs normally on the right are now on the left and vice versa. Bearing this in mind, Clark, on which side would you expect to find the appendix?
On the other side, sir?
Go away. Mr. Andrews, we're holding a little conference here this afternoon. With your permission, we should like to present you there. No need to undress, it's quite informal. Waring. Don't let him out of your sight. 3 o'clock, then.
Yes, sir.
Hey, is that bloke your governor? Mm-hmm. He's like a station master, isn't he? All puff and whistle. Oh, well, I think I'll be going now, Dr. Waring.
What? No, you're not going to stay?
Oh, I don't think so. No, I don't think I can stay. It's really not my scene at all.
Well,
I don't
but
think I fancy it.
Duncan, what a spot of luck for you, eh?
Yeah,
Still no hard feelings. Chief thinks yours is a better case. Who am I to disagree?
Right.
I do, though.
Yeah, go on. Now, look, Mr. Andrews. Mr. Andrews, you can go if you want to. I can't stop you leaving hospital, but, has your stomachache gone?
Oh, aye, it's gone. As a matter of fact, I'm working up quite an appetite.
What are you going to do about lunch?
Well, I've got some sandwiches left.
Are they the ones from Preston?
Aye. What's wrong with them?
Oh, well, we don't know. We're going to have to send them off to be analysed.
You what?
Well, it could be food poisoning.
Food poisoning? Hey, there's only one person who could have done that. That's the wife.
I'll make you a deal. You stay for the conference, I'll make sure you get the full VIP treatment. That means you start with a 3-course lunch. What do you say?
Well, that sounds fair. Very fair.
Oh, very good, very good. But I know the canteen is shut at 2 o'clock, but couldn't you make an exception? Well, you must have something left over. There ain't nothing happening till tea time.
Oh, Duncan, have you seen Maureen?
Look, Dick, can you forget about Maureen for 5 minutes and do me a favour? I've got to nip down to the kitchens and get a meal for Andrews.
Well, let them do it. It's not your job. You're a surgical registrar. You don't see the woman with a potato scoop assisting in theatres? The way the health service is going, it won't be very long.
Dick, please, it'd only take 5 minutes. I just wanted you to keep my conference patient happy, you know. Anything you like, just make sure he doesn't get out of that.
I'd love to help you, old boy, but I'm in the middle of something terribly important.
There could be money in it for you.
Could there?
Yes, he plays cards.
Cards? Does he?
Yeah.
Oh, right.
Sorry, there we are.
After you, Sir Edmund.
Thank you.
I say, is that your lunch? It smells very delicious indeed. That's a very smart get-up for a porter, Loftus.
You're very privileged, Waring. Sir Edmund Steele doesn't often talk to porters.
Oh, on the contrary. I think it's so nice to meet staff at all levels. After all, when you come down to it, we all help to keep a hospital running, don't we?
Well, I am Professor Loftus's registrar, and we have met before.
Oh, my dear fellow, yes, of course. Oh! Well, really, Loftus, I must say it's a pretty kettle of fish when the registrar has to eat his luncheon in the lift. At High Cross, we have a very modern, first-rate canteen open 24 hours a day. Oh. At High Cross, we have a service lift for this kind of thing.
Ah, yes, well, St. Swithin's is a hospital, not a departmental store.
Oh, I look forward to your case.
So do I, Waring. The conference begins in 5 minutes.
What?
Hope it won't inconvenience you to be there.
Well, I mean, let's oh, sorry. All right, watch. After you. After you. That's it. That's it.
I'll see you. Load of rubbish. 3 kings. Come on, that's another £2 you owe me.
Dick, come on, let's get going.
Oh, dear, we'll have to stop. What kept you?
Well, no, the conference has been moved forward.
Oh, really?
Yes,
Oh,
come
but
on.
listen, I'm not ill. I can walk. What do you want
Dick,
me
get
to
off
throw
now,
it
will
for?
you? Come
Oh,
on,
yeah,
go
okay.
get the X-rays on the
What
table.
about my nose? Oh, my...
In conclusion, then, we have here a case of Waldenström's macroglobulinemia, classically presenting with lymphadenopathy, hepatosplenomegaly, and epistaxis. And the underlying chemistry of this rare condition was worked out by the High Cross team. This work was done with the aid of our new refrigerated magnetic-bearing ultracentrifuge, one of the most modern in Europe. Thank you.
Perfect timing.
Ah, there you are, Duncan. Yes, only just in time. But you missed Sir Edmund's presentation. It's first rate.
Yeah.
I don't envy you having to follow it. Oh, hello there. I really enjoyed your case, thank you. But there was one thing which nobody mentioned that I wanted to raise, which was the subject that if your liver...
Toad. Right, here we go.
Yeah, well, just get out there and make them laugh.
Yeah, well, look, take me about 10 minutes to get through this history, okay? You just make sure he stays here.
Right.
All right?
Okay.
Hey, what are they talking about in there?
Oh, usual doctor's talk. Cars, yachts, golf, that sort of thing.
Oh, I see. Well, come on, what about our game?
Yeah, well, I'll deal this time.
We want a flat surface.
Oh, we'll use this. Oh, my God.
Well, come on, get it down.
Yes, look, I'll just have to go and get your x-rays and have a quick game of patience. I won't be 2 minutes.
Patience, he says. I've been waiting 2 solid hours for me lunch.
The heart is on the right, and the liver is on the left, and the spleen is on the right, and the appendix is on the left.
Right, Dr. Waring?
I'm sorry, the appendix is on the right.
On the left. Sorry? The appendix is on the left.
Oh, right. That just about wraps it up. Any questions?
I don't think so, really, and so very straightforward a case. I don't think we need any further detail. Isn't it about time you saw the patient, Loftus?
Well, I was coming to that, sir.
That's all right, Waring. Just because the last case went on for so long, it doesn't mean that you have to hurry. So far, you've been brief and to the point, as a surgeon should be. Otherwise, you'd never get through his work.
Thank you, sir.
But don't just stand there. Get on with it.
Oh, yes, I'm sorry. And so we come to the most important part, the patient. Strangers! Help! Well, it appears that the patient is still undergoing final tests, and, but I do have some rather interesting X-rays here that I think I might ask Sir Geoffrey to take us through.
By all means. come on, Waring. We'd like to see them.
Yes, of course.
What's the matter with you? Just put up the first film.
Oh, Maureen, where are the X-rays I left on the table?
Gone to the museum.
What?
Do you want them?
Well, of course I want them.
Well, I'm sure you could get them by tomorrow morning.
Oh, that's far too late. You're going to have to take some of me and change the labels.
Well, that sounds rather unethical, Dr. Stuart Clark. I really don't
There
think
you are, Maureen. Have you got a minute?
Look, Dr. Gascoigne, I'm doing some rather urgent work for Dr. Stuart Clark.
So push off. Follow me, Maureen. What are you doing here? You're supposed to be waiting for me upstairs.
Yeah, well, I've had enough of this, like, I'm going.
Oh, no, you're not. Maureen, a chest X-ray of Mr. Andrews. Come along.
What? I thought I was going to do you.
Later, Maureen, later.
And what makes these X-rays of particular interest is that apart from the one gross abnormality, there are no other pathological findings. In fact, they're the X-rays of a very well-preserved middle-aged man.
They are, indeed, sir.
Well, bring him in and let's see if I'm right.
Well, yes, sir. I don't think that's possible, sir.
Why not?
I don't think he's here yet, sir.
What do you mean you don't think he's here? Is he or isn't he? Well?
He isn't, sir.
Oh, really, Loftus?
Just a moment, Sir Edmund. Why is he not here, Waring?
Well, the explanation seems obvious. St. Swithin's has no case. We haven't yet seen a sign of a patient. And as for these X-rays we've been looking at, well, they might be just anybody's turned the wrong way round.
Have a care, Sir Edmund. We have been told that the patient is completing some important investigations. His name is Mr. Andrews. And these X-rays are indeed the X-rays of Mr. Andrews.
Well, so you say.
Are you suggesting that my registrar and I are involved in some kind of conspiracy?
Oh, my dear fellow, I'm only saying that I haven't seen a case of dextrocardia in years, and I'm wondering whether you have. Where is the patient, Loftus?
Where is the patient, Waring?
Well, he's, May I present Mr. Andrews?
Preston!
Oh, well, now we shall see, shan't we? Loftus, you win.
Hey! Were you two having bets on me?
I don't want to know why everything went wrong, Waring. The fact is that it did. Do you realize that I came within an ace of being exposed to some kind of medical charlatan?
Oh, surely not, sir.
Oh, surely, yes, sir. And I would have been too if it hadn't been for your friend Clark's totally untypical resourcefulness.
Thank you, Sir Geoffrey.
Shut up. I don't know how it happened, but you've got a lot to thank him for.
Oh, yeah, he was a great help, sir.
From now on, Waring, you are going to need all the help you can get. By the time I've rewritten your references, you'll be lucky to get a job as a ward orderly.
No, never mind, Duncan. You don't really want to be a consultant anyway. You're not the ambitious sort.
Well, you got me into this mess. Losing Andrews and his X-rays. Where were you this afternoon?
Well, I like that. I was on a job with Maureen.
You animal.
If you must know, I was sorting out the X-rays for you.
Oh, Duncan, have you got Mrs. Button's X-rays? She's in a terrible hurry to get home.
Oh, yeah.
Awfully bad luck that messing up the conference this afternoon, wasn't it?
Here, Doctor, you're going to be long, because I can't get home to feed my hedgehogs, and we're getting
Hey, Gascoigne. Who did you say these belong to?
Oh, Mrs. Button, you know, the case I was going to present at the conference this
Yes.
afternoon.
What a pity you didn't have a look at these before the conference.
I did. Why?
Oh, look at the tarsals.
What tassel?
Look at the tarsals. Look at the length of the bone, the way they're fused.
Oh,
It's a throwback, a congenital malformation. It's a vestigial hoof.
Here, are you calling a vegetable oil?
No, it's the case of the century. Oh, what an awful pity you didn't spot that. Here you go.
What about your gaffing? Come on, come on.